I don't think so. It's a normal illness, so it's just a bit less usual than others, but it's not their
fault.
Their fault, yes.
I also think it's never your fault if your partner or something doesn't tell you. It's not your fault, but you can protect yourself. But it's never your fault. I don't think so. No.
You know, the issue of HIV, it's very, very big one. It has also a bigger influence. And if I want to answer this question, I want to answer it this way. Many people, they go straight, who's going to be blamed for the infection? Whose responsibility was it? But these questions regarding the HIV infection or transmission, they don't lead us to a constructive discussion, to a constructive answer to the problem. So what we should have to do is, we should have to know exactly what are the transmission ways, how do we get the infection, how do we get the virus. These are the most important things that we should have to put into consideration. Once we know this one, then we can protect ourselves, and then we can protect our family, we can protect the community, we can protect the whole population. So very important is, what are the transmission ways? I specify this particular to Switzerland because there could be also in other contexts or in other countries other means of transmission, additional means of transmission. But here in Switzerland, the most important means of transmission are sexual contact. If we have a sexual contact using without condom, then the probability that we can get an HIV virus from somebody who is infected is high. So this is the first one. And then the second one, which is also important in Switzerland, is syringes, which are used for drugs. People who take drugs through syringes, for example, this could put them in a risk if they exchange the syringes. If you keep your own syringe, there is no any problem, needle. But if you keep exchanging with your friends, for example, or with the ones who are taking the drugs, then the probability that you're going to get the HIV virus from these individuals who are infected is high. And then the third very important issue is a mother to a child. A mother can give the HIV virus to her child, particularly during the pregnancy, when the child in womb or in thoracis. And the other issue, or the other case that the child infected can is during the delivery, because there could be blood contact this time. And then the third one is when she tries to feed the child milk, that means as a breast milk. So these are the most important things that we should have to put into consideration.
As far as I know, there is no cure against HIV, like against AIDS in general. But I think you can treat it, but you can not escape it. Like once you're infected with it, you cannot get rid of it.
Yeah, there are just medicaments that can help you to live a better life, but it cannot cure you. Yeah, you cannot recover from it.
Right, so unfortunately until this day there is no cure for the HIV virus whatsoever. You have got a treatment which is a so-called ART, an antiretroviral therapy. This means that even if you are positive, you cannot pass on your virus to another person, even if you have unprotected sexual encounters. It is a medical treatment, as I just mentioned, that suppresses the virus so far down that you can't pass it on to someone else. Now, this is really an important fact to know. I will repeat, because this is really important. A person which is successfully under the ART therapy does not transmit the HIV virus to another person, even during unprotected sex. Also important to know is that a pregnant woman cannot pass on the HIV virus to her child by giving birth if she is under successful therapy.
I don't know it, I'm not a woman, but I don't think so.
No, they do not. The anti-baby pill, the contraceptive, as well as the IUD only protect you against unwanted pregnancy, but not against HIV, as all hormonal contraceptives do. The only way to successfully protect yourself against HIV is either a condom for the penis or the vulva, a so-called femidom, and that's it. And they only protect you against HIV and unwanted pregnancy, unfortunately only to a certain amount towards the other STIs like chlamydia, gonorrhea and syphilis. They are whatsoever very reliable protection against HIV. For other STIs, they do reduce the likelihood of transmission. Certain STIs, more likely like hepatitis A, B, as well as the human papillomavirus, you can get a vaccination against them, which you would have a lifelong security that you will not get an infection with those. Testing for and treating infection can also be seen as a protection, as they cannot do any harm and cannot get transmitted to someone else if successfully treated.
I think they have a chance to get it. They don't have a chance, like 100% chance to get HIV, I think.
It is possible that babies of a mother with HIV get infected during pregnancy, vaginal childbirth or breastfeeding, because vaginal fluid, blood and breast milk are potentially infectious body fluids. However, mother-to-child transmissions are extremely rare these days in Switzerland. Why? Because every pregnant woman is offered an HIV test at her first prenatal checkup. If an HIV infection is discovered, she can immediately start with HIV treatment. In a situation where at the moment of birth there's still a risk of infection for the baby will be delivered by cesarean section. In this way, an HIV transmission is prevented. If a mother can and wants to breastfeed, is a topic of discussion with her gynecologist and her infectiologist. If she decides not to, the baby can be nourished by with breast milk substitute.
After you had sex with someone, or yes, I think after it, or even before it, before you have, like when you have a new partner or something like this to test yourself, so it doesn't affect someone. Even if someone has something, you can even stop it before something happens.
Yes, a test can be done to clarify your status for HIV and STIs, especially recommended if you go into a new relationship and you would like to leave the condom away to have sex with each other. We recommend to get tested at least once a year for people which have got changing sexual partners for HIV and the most common STIs, which would be chlamydia, gonorrhea, syphilis and obviously HIV. An HIV test will give you results, or it only makes sense to do an HIV test at least 6 weeks after your last sexual risk situation. Our tests are very sensitive, but nonetheless you do need to have a certain amount of time in between the HIV test or the STI test and your last risk situation. Now, the time frame for those infections would be for chlamydia and gonorrhea, it's the shortest amount of time, it would just be 3 weeks at the minimum. For HIV, it would be 6 weeks. And for syphilis, it's the longest period of time, it would be up to 2 months, which you need to wait in between so you can have a real result. The Problem is, if you would get tested beforehand, the danger would be that you could get a false negative result. And as also said, getting tested is also a way of protecting other people, because if you get tested positively on a sexually transmitted infection, you can get treatment for it, and therefore you would not be, or you could not transmit it to someone else anymore, which means you would also protect the others for having another sexual infection. In case of pregnancy, it is important to know that at your first prenatal checkup, it is offered to every woman to do an HIV and STI check to be sure that you do not pass on an infection, a possible infection or HIV to your child. So this is offered for every woman in her first prenatal checkup, and also an important fact to know.
Yes, I can still invite him or her, yeah, because you see, it's not something that you can transmit through voice or whatever. You can even shake hands with him. After, maybe when he left, I can do some cleanings and start up. Yes, I can invite him. Why not?
Yeah, I stay with people who are infected, who had the infection. Well, unfortunately, HIV is not curable, but it can be treated. We can handle the problem, but we cannot totally cure the infection. It's a chronic one. Once we are infected forever. But if you see by different communities, the issue of the social feedbacks, or the feedbacks that we get from the community or from the population, sometimes they are more than the infection, more than the virus. Even they could hurt you very strongly. And what I want to say is, if I know exactly what are the transmission ways of HIV, then I can be a friend, for example. I can invite, for example, somebody who is HIV positive to my house. There's no any problem of getting the infection. We have already explained it. What are the transmission ways? Sex contact without condom, exchange of syringes for somebody who takes drugs through needles, or a mother to child. Outside these stuffs, there's no any problem of having HIV here in Switzerland. So I can dine with an HIV positive person. There's no any problem. I will invite him. He can swim also with me, for example. There's no any problem. I can do many activities with him without being into a risky situation. Important is here also, just to make it clear, what are the transmission ways, what are not the transmission ways, or not possible transmissions means. You don't get HIV through sneezing, for example. If somebody coughs in front of you, then you don't have any problem of having HIV. There's no any problem with that one. Actually, there are other diseases which are transmittable through coughing or sneezing, but HIV is unable to be transmitted from an individual to an individual through coughing or through sneezing.